Britain announced another national lockdown trying to stop the spread of a new coronavirus variant. And here to discuss that and other pandemic developments is Dr. Brian Hollenbeck, Chief of the Division of Infectious Disease at New England Baptist Hospital. Thanks for being here.
Thank you for having me.
So first things first, can you give us a progress report? Let's talk about what hospitals in this area are seeing right now in terms of people maybe needing ER care or needing to be admitted because of COVID-19.
Yeah, hospitals across the state, especially within the Boston area and South Coast, are pretty strained right now, I would say. A lot of hospitals are using surge capacity, looking for alternative ways to staff inpatient scenarios and cutting back on things that can be cut back on, like elective surgeries and procedures and things like that. So it's already under quite a bit of strain right now, I would say.
So when we think about that strain, shifting back to Britain for a second, their health system being overwhelmed, that national lockdown happening, a lot of people looking at that and seeing what's happening in the state, wondering if the U.S. can handle what's expected in the next few weeks with post-holiday cases. What do you think?
Well, it will be hard, to be clear. I think all predictions are that the surge will continue and hopefully, if we're lucky, peak in late January, with hospitalizations, peaking around that time. Most of the transmission right now is within households and within small groups that are gathering and just not following the protocols. So I think we have to look at things like lockdowns, but we also just have to double down on the basics of being smart about our decisions of group gathering and wearing masks and social distancing and all these things.
The vaccines do bring some hope. Also in Britain, there's this strategy of immunizing as many people as possible with just that first dose and then postponing the second dose at this point. What do you think of this? Is that dangerous, or is it a good strategy based on the spread they're seeing there?
Well, I think their situation may be a little bit different than ours. We, ideally we'd be able to give everybody the second dose. We know that there is some efficacy to that first dose, and so there is some immunity that people get by getting a single dose. Right now in Massachusetts, there's no doubt we need to move faster at vaccinations, but I think we're really ramping it up, last week, this week, and moving forward, pulling in retired nurses, pharmacy interns, anyone who can safely give vaccines to just be able to get it to people. And so far, our issue has not been not having enough vaccine, it's been getting it to people.
Right, right. I feel like we're constantly learning more new strains of the virus. There was focus on one from the UK. Now they're talking about one in South Africa that could present even more of a danger. Why is that? And what do we know about this variant?
Yeah, so I think importantly, any of these variants are really predicted. This is something we know about any new virus, or any old virus for that matter, that over time it will develop mutations, and some of these mutations will be important clinically. They'll change the way that the virus acts. And typically what viruses do is they become more contagious and less deadly over time. And so far that seems to be the case at least for both of these. They seem more contagious, and that's why they've been noticed, I would say. But no evidence that they won't be covered by vaccines, and no evidence so far that they would be more harmful to patients that get the virus.
Important insight. All right, Dr. Hollenbeck, thank you for your time. We really appreciate it.